Okay, people, so we're back, and as we return, of course, it's Tuesday, so Seth Wile aboard is here, and we're 13 minutes away from the hour of 8 o'clock. I just want to bring up a headline. This is the headline. This is actually a topic we'll be talking about, where it relates to infertility. So just before, or we can bring in Seth, and I'll just read the article. The headline was, Doctor says herbs not curing infertility problems in Trinidad and Tobago. I'll just read you the first 3 paragraphs. A medical doctor is warning about the overuse of herbs in the population, especially when it comes to fertility. The medical director of the Trinidad and Tobago IVF and Fertility Center, Dr. Catherine Minto-Bain, has urged couples trying to conceive to be careful when using herbal medication. She says, quote, I think we are way too attached to popping something into our mouths or taking some sort of herbal treatment. Those things might work for certain issues in health, but herbs, they are all just myths when it comes to fertility, she said. Seth, morning. Let me hear this one now.
Morning.
Yeah.
Morning. Thanks for having me on.
Yeah, bud.
All of our viewers are doing well. All right, so let's jump to it.
One time.
So let me share my screen here. Let's take a look at this article. All right. And what is being said with regards to the topic.
Right.
All right. Now, something that I think stands out and is something that I have been saying is this line here. When she said, I think we are way too attached to popping something into our mouth or taking some sort of herbal treatment. Now, the popping something into our mouth would be in reference to medication.
Right.
And then the other thing that she drew reference to is the herbal treatment.
Right.
Because further down, she would talk about certain issues or certain things here, testosterone, which is a contraceptive, because most people don't know when you use testosterone, it when you come off of it, it lowers your body's ability to produce testosterone. So that is not helping. But most people in gym would know more about that because that's the environment where testosterone is used in a big way, right? So they'll know of the negative side effects of it, and then there are issues that it can cause with the liver and other organs in the body. But down here, where she says women of East Indian descent tend to have more polycystic ovarian syndrome, which she said requires treatment to have a baby. On the other hand, women of African descent experience menopause earlier. She further mentioned things like endometriosis, which are conditions that women suffer from. Right? So let me get back to us here now. One of the issues is that many people would contact me and call me and ask and say, what do I have to take or to give them to take for this or for that? Yeah. And that's the mindset that we have been groomed to have, is always to take something for something. And the focus don't be on why you even have the problem in the first place. Yeah. You need to start looking at cause instead of just trying to take things to suppress symptoms. Now, I'm not going to say there are no studies showing that herbs don't help with fertility. There are studies showing herbs don't help with fertility. Herbs help with fertility, yes. But those same studies would tell you that though they have seen that it can improve conditions of infertility, there are no studies done on the negative aspects of it. How long it should be taken for, what are the side effects. Now, these are the things with drugs on the other hand. When it comes to drugs on the other hand, the side effects and the duration that you should be taking the drugs for are known. Herbs on the other hand, a doctor cannot tell somebody to take herbs because there aren't enough studies done. So the possible side effects, they are unknown. Now, based on my knowledge and understanding of herbs and the other compounds that come with it, there would be side effects. In fact, many health issues that people suffer from can be and have been linked to the use and consumption of herbs. So therefore, somebody in medical practice can recommend the use of herbs. The problem I have, as you know, I have problems with herbalists, is the simple fact that they do not know the side effects of things that they are recommending. And therefore, a lot of people have come to me, have been damaged, and not just small damage, but have been severely damaged from using herbal products. So what I tell people is when you come to me, I educate people on what the human body is genetically and biologically designed to consume. Understand that, and then I coach them in that aspect, coach them nutritionally, coach them with regards to lifestyle, because this is where the changes need to be made if you want to safeguard yourself from getting a disease, or if you want to reverse a disease. It's a lifestyle change, right?
Yeah.
And not just pop something without changing your lifestyle, because that is what people love to do. The general public love to pop something because they don't want to make any lifestyle changes, and eventually the things that you're popping going and eventually start to cause harm to the body on top of the issue that you were taking it for. So now you have issues compounding on each other and going to develop into a greater health problem, right?
Okay.
So what I do, I educate, education, and that's the problem with in both the medical and the herbal community. They don't focus on educating the people. It's basically follow me blindly because I say, right? What I do, because I understand the fact that people would quicker make changes if they understand why those changes need to be made. So that's what I focus on. If you educate and someone is informed, they understand, you show them the science, because you know you have the other aspect where somebody might tell you something that's just their opinion, right? An opinion can appeal to someone's biases, and someone might think that person's opinion is factual because it agrees with their so-called confirmation bias.
Right.
You know, you hear something that you want to hear, but is that thing that you heard, is it true?
Yeah.
That's the question that one needs to ask. And we need to be better able to analyze information, better able to analyze data, so that we can make the best decisions for our health. So this little topic here would lead to, of course, because I still want to finish off what I was looking at, because you still have to look at pigmented stones that cause gallbladder stones, right? But all of this is going to be connected and link into each other and run smoothly into each other, because your entire body is connected. So the consumption of certain things, both medicine and herbs, can cause problems that could lead to the creation of pigmented gallstones.
Okay.
And these can cause hormonal disorders that can give rise to conditions like polycystic ovarian syndrome and things like endometriosis, and can lead to early onset of menopause. Right? So all these things are intrinsically connected. And as we go on over the next couple of weeks, we're going to start looking at those things, because a lot of females have called me and messaged me and asked me to deal with topics like PCOS and endometriosis. So I know it's something that I have in my mind set to deal publicly on this program.
Right.
Because fertility is a big issue. Keep in mind also that a lot of fertility problems, a lot of couples that can't have kids, the majority of the issue stems with the man. We look at fetal alcohol syndrome spectrum disorder some couple months ago, showing that condition and Down syndrome are actually the same.
Right.
One just being when the father, like Down syndrome is fetal alcohol spectrum disorder, when the father is consuming alcohol during the time of trying to conceive. The other one is when the mother is consuming alcohol during the time of trying to conceive.
Right.
And these are factors. When you think about it, alcohol is something people don't want to give up. So then they would quicker want to pop a pill. Right? They would quicker want to pop a pill instead of cut the alcohol.
Yeah.
But, but the side effects of that is you can now negatively affect the growth and development of your child, not just physically, but mentally as well. So, like I said, what I do, I educate people. When you're educated, you make more informed decisions. And when you make an informed decision, it's a much better decision. Because as for those that are on the religious side, Hosea 4:6, for my people are destroyed for lack of knowledge, right? And the more knowledge you acquire, the better you are to save yourself from destruction, because many of us are self-destructing and we are unaware that we are the cause for our own demise. All right, so I would encourage people, book an appointment, come see me, get to learn and understand nutrition and health a lot better, so that you could be way more informed right? Way more informed when it comes to your decisions.
All right. Seth, thanks a lot, man. You could pass through Saturday and just have some fun, you know. Try, I mean, listen.
Yeah, I intend to.
I only dunk tank. Anybody that could dunk me 3 times, they're winning an adult prize. So call Seth 761-1952, 761-1952, and book your appointment today on any, you know, problem that you have, any disease you have. Seth is always willing to, well, he always has terrific information, and then it's up to you to know what you want to do with that information, if you want to say yay or nay. So you always have the option, freedom of choice. So Seth, thanks a lot, man.
Thanks for having me.
All right. So that is Seth Weil aboard on the inside there, and Seth doing his thing, man, with holistic health.